The final mountain that nursing students must summit before becoming a registered nurse is the NCLEX. Preparing for the NCLEX can be stressful, as taking in colossal amounts of information has never been easy. This is where this cram sheet can help. It contains condensed facts about the licensure exam and key nursing information. When exam time comes, you can write and transfer these vital information from your head to a blank sheet of paper provided by the testing center. 1. Test information 6 hours. The maximum time allotted for the NCLEX is 6 hours. Take breaks if you need a timeout or need to move around. 75 265ths. The minimum number of questions you can answer is 75 and a maximum of 265. Read the question and answers carefully. Do not jump into conclusions or make wild guesses. Look for keywords. Avoid answers with absolutes like always, never, all, every, only, must, except, none, or no. Don't read into the question. Never assume anything that has not been specifically mentioned, and don't add extra meaning to the question. Eliminate answers that are clearly wrong or incorrect, to increase your probability of selecting the correct answer. Watch for grammatical inconsistencies. Subjects and verbs should agree. If the question is an incomplete sentence, the correct answer should complete the question in a grammatically correct manner. Rephrase the question. Putting the question into your own words can pluck the unneeded info and reveal the core of the stem. Make an educated guess. If you can't make the best answer for a question after carefully reading it, choose the answer with the most information. 2. Vital signs: heart rate, 80 to 100 BPM respiratory rate, 12 to 20 revolutions per minute blood pressure, 110 to 120 sixtieths of a millimeter of mercury temperature, 37 degrees Celsius, 98.6. Degree F. 3. Hematology values: RBCs, 4.5 to 5.0. Million WBCs, 5,000 to 10,000 platelets, 200,000 to 400,000 hemoglobin, HGB, 12 to 16 GM, female. 14 to 18 GM, male. Hematocrit, HCT, 37 to 47, female. 40 to 54, male, 4. Serum electrolyte: sodium, 135 to 145 MEq, L potassium, 3.5 to 5.5. MEq, L calcium, 8.5 to 10.9. MEq, L chloride, 95 to 105 MEq, L magnesium, 1.5 to 2.5. MEq, L phosphorus, 2.5 to 4.5. MEq, L. 5. ABG values: pH, 7.36 to 7.45 HCO3, 24 to 26 MEq, LCO2, 35 to 45 MEq, LPOW2, 80% to 100% SAO2, greater than 95% 6. Acid-base balance: remember Rome, respiratory opposite, metabolic equal. To remember that in respiratory acid-base disorders, the pH is opposite to the other components. Use the tic-tac-toe method for interpreting ABGs. Read more about it here. http://bit.ly/abgtictactoe. 7. Chemistry values: glucose, 70 to 110 milligrams per deciliter specific gravity, 1.010 to 1.030 bun, 7 to 22 milligram per deciliter serum creatinine, 0.6 to 1.35 milligram per deciliter LDH, 100 to 190 U, L protein, 6.2 to 8.1. Gram per deciliter albumin, 3.4 to 5.0. Gram per deciliter bilirubin, less than 1.0. Milligram per deciliter total cholesterol, 130 to 200 milligrams per deciliter triglyceride, 40 to 50 milligrams per deciliter uric acid, 3.5 to 7.5. Milligram per deciliter CPK, 21 to 232 U, L. Drug levels: carbamazepine, Tegretol, 4 to 10 mcg per milliliter digoxin, Lanoxin, 0.8 to 2.0. Nanogram per milliliter gentamicin, garamicin, 5 to 10 mcg per milliliter, peak, less than 2.0. mcg per milliliter, Valley, lithium, escalith, 0.8 to 1.5. MEq, L-phenobarbital, sulfatin, 15 to 40 mcg per milliliter phenytoin, dilantin, 10 to 20 mcg per deciliter theophylline, aminophylline, 10 to 20 mcg per deciliter tobramycin, Tobrix. 5 to 10 mcg per milliliter, peak, 0.5 to 2.0 mcg per milliliter, Valley, valproic acid, Dipakine, 50 to 100 mcg per milliliter vancomycin, Vancomycin, 20 to 40 mcg per milliliter, peak, 5 to 15 mcg per milliliter, trough, 9. Anticoagulant therapy sodium warfarin, Coumadin, PT, 10 to 12 seconds, control. The antidote is vitamin K, INR, Coumadin, 0.9 to 1.2. Heparin PTT, 30 to 45 seconds, control. The antidote is protamine sulfate, APTT, 23.3 to 31.9 seconds. Fibrinogen level, 203 to 377 milligrams per deciliter. 10. Conversions: 1 teaspoon, T, equals 5 milliliters. 1 tablespoon, T, equals 3 T equals 15 milliliters. 1 ounce equals 30 milliliters. 1 cup equals 8 ounces. 1 quart equals 2 pints. 1 pint equals 2 cups. 1 grain, GR, equals 60 milligrams. 1 gram, G, equals 1000 milligrams. 1 kilogram, equals 2.2. LBS 1 pound equals 16 ounces. Convert C to F. C plus 40 multiply by 9/5 and subtract 40. Convert F to C. F plus 40 multiply by 5/9 and subtract 40. 11. Maternity normal values: fetal heart rate, 120 to 160 bpm. Variability, 6 to 10 bpm. Amniotic fluid, 500 to 1200 milliliters. Contractions, 2 to 5 minutes apart with duration of less than 90 seconds and intensity of less than 100 millimeters of mercury. Apgar scoring: appearance, pulses, grimace, activity, reflex irritability. Done at 1 and 5 minutes with a score of 0 for absent, 1 for decreased, and 2 for strongly positive. Scores 7 and above are generally normal, 4 to 6 fairly low, and 3 and below are generally regarded as critically low. AVA: the umbilical cord has 2 arteries and 1 vein. 12. Stop treatment for maternal hypotension after an epidural anesthesia. Stop infusion of pitocin. Turn the client on her left side. Administer oxygen. If hypovolemia is present, push IV fluids. 13. Pregnancy category of drugs: Category A. No risk in controlled human studies. Category B. No risk in other studies. Examples: amoxicillin, cefotaxime. Category C. Risk not ruled out. Examples: rifampicin, rifampin, theophylline, Theolair. Category D. Positive evidence of risk. Examples: phenytoin, tetracycline. Category X. Contraindicated in pregnancy. Examples: isotretinoin, Accutane, thalidomide, immunoprin, etc. Pregnancy category N, not yet classified. 14. Drug schedule: Schedule 1. No currently accepted medical use and for research use only, e.g., heroin, LSD, MDMA. Schedule 2. Drugs with high potential for abuse and requires written prescription, e.g., Ritalin, hydromorphone, Dilaudid, meperidine, Demerol, and fentanyl. Schedule 3. Requires new prescription after 6 months or 5 refills, e.g., codeine, testosterone, ketamine. Schedule 4. Requires new prescription after 6 months, e.g., Darvin, Xanax, Soma, and Valium. Schedule 5. Dispensed as any other prescription or without prescription, e.g., cough preparations, Lomotil, Motofen. 15. Medication classifications: antacids, reduces hydrochloric acid in the stomach. Antianemics, increases blood cell production.